So we have a huge problem within the county of Lancaster, actually within the United States as a whole, and that is addiction to opiate medications.
This last year in 2015, we had 1,100 overdoses dispatched for our service, which is roughly 5% of our 911 volume.
This crosses all socioeconomic boundaries and all geographic locations. We see heroin addiction in the rural areas of Lancaster. We see it in the urban areas of Lancaster. We see it among the rich. We see it among the poor and all ethnic groups. So it's multicultural.
My name is Jack Pacewicz. Right now, I have my own business. I'm also a recovering addict. When you're in a life of addiction, first of all, you don't feel like you belong here. You just have this void in your life, and you can't get the support that you need long term in order to recover. It's everywhere you go.
I think sometimes we panic and we don't know what to do, or somebody may be breathing shallow and people are just thinking they're sleeping when really they could be, falling closer and closer to death.
There is a drug, Narcan, and it reverses the opiate impact and the respiratory depression that these patients experience with the overdoses. We're trying to put Narcan out more in the hands of the first responders. If you can get to the patient soon enough, you can eliminate that risk and let the patient start to breathe on their own and prevent cardiac arrest.
And what we're doing is we're taking a medication that has typically been prescribed for medical professionals or for emergency rooms, and now dispersing it to the community in an effort to kind of stem this rising tide of deaths associated with opiate addiction. Essentially, you find somebody who is not breathing, the first thing you want to do is call 911. 911 absolutely has to be the first step in any of these emergencies.
This is the Narcan kit. So as you can see, it's a plastic kit which has the application that allows us to administer the kit. We have the Narcan medication itself, which will come out of the kit. You pop the top, pop the bottom, you screw it on. At that point, you remove the yellow tab and place the atomizer and screw on tightly. Now we're ready for administration. So once you come upon the patient who is either unconscious or breathing shallow, you would take the nasal applicator and place it inside the nostril. You will then inject 1 cc of the medication in one nostril, come over to the other nostril, and inject the remaining 1 cc into that nostril. After you call 911 and you administer the Narcan, at some point we do ask the providers of the Narcan to call our toll-free number, which is 1-844-9-NARCAN.
After this, the patient internally has to make a decision that he is or she is ready for rehabilitation.
There are 23 million Americans living in long-term recovery. So there are people in all walks of life. There are congressmen, there are NBA stars, there are lawyers, there are doctors. If you don't save that life, that opportunity is gone.
But we know that we have 500 doses of Narcan, and each one of those doses of Narcan has the opportunity to reverse a life-threatening drug overdose. So theoretically, you could have 500 lives saved.
I belong to a church, I'm married, I've got an excellent life, I've got an awesome, incredible wife. If my life hadn't been saved, I wouldn't be here.